Hello, everyone, and thank you so much for the invitation. I'm very happy to be able to be here, and I'm also very honored and proud to follow in the footsteps of so many excellent speakers and very prominent and very famous scholars dealing with interpreting research. I'm actually presenting on behalf of our whole team of 3 members, which is me, Sonia Pula-Bauer, and Victoria Stracek-Helios. Definitely, they also deserve our appreciation for this work. And I'm going to talk about interpreting in a very, very specific setting, and in a very specific context of abortion travel, which is sometimes also called abortion tourism, the context which I'm afraid might also become more prominent for the United States in the nearest future. Right, so let me present an outline of my talk. I will start with the background for the whole study and our method and material. And then for a while, I will focus on just one aspect, one of the aspects that we have investigated, interpreting ethics. So I will present this topic in detail. And then at the end, I will try to leave some time to give you a preview of the other prominent topic that we investigated, and this one is emotions. So first of all, the background. And what I'm talking about is mainly based on this paper, which was published this spring in Interpreting. The paper is open access, so if you want to read up on this study, it's accessible for free to everyone, thanks to the generosity of the University of Vienna. So about the background. Why does this particular setting exist at all? It exists because of the reproductive rights infringements that we have in Poland. And this is not a very new phenomenon, I'm afraid. This is something that has existed in Poland for more than 30 years already. Abortion was banned back in 1993. So if you know the history of Central Europe, this was shortly after the fall of communism. And this abortion ban in Poland can be seen as a kind of thank you to the Catholic Church for the prominent role that the Catholic Church has played in overthrowing communism, which I absolutely don't deny. And after the fall of communism, the Catholic Church became very, very influential and had lots of impact on the introduction of this particular law. But the law that was introduced those 30 plus years ago had 3 important exceptions. So a pregnancy could still be terminated in 3 cases: danger to life or health of the pregnant woman, a pregnancy caused by a crime, so typically a rape, and fetal impairment. And this 3rd exception, fetal impairment, was actually abolished in 2020. So the law was even strengthened after all those years, removing the one exception, which was the most frequent one. So for those 30 years, most of the legal abortions that happened in Poland were due to some kind of fetal impairment, and that was that exception was abolished, as I said, which caused massive protests all around Poland. You can see a picture from one of those protests here. But the protests were unsuccessful. And I must say, although for more a year now, we have a new, more democratic, more progressive government, the law still remains in force, and it's very difficult to liberalize for various reasons, which I don't have time to discuss. But they are even talking about this law tonight in the Polish parliament. There will be a voting related to one of the proposals to liberalize that law. So I very much hope that this vote will be successful. Right. And the situation is very much different in Austria. So in most European countries, as a matter of course. So in Austria, a pregnancy can be terminated on demand until 14th week of pregnancy, even longer than that in cases of fetal impairment, which is a bit tricky for foreigners, but anyway. And women from abroad can terminate in private abortion clinics against payments. And there is also another option, one that we didn't know about. I only learned about this when doing the research. In Austria, there is also the possibility to give birth anonymously in a hospital and to put up the baby for an adoption. So this is not something, like, as you can see in the slide, this is not something that happens very, very often, but it is also a possibility. So the mother doesn't have to reveal her identity, and the baby is taken by the adoptive family very, very quickly, like the next day after the birth. They already take the baby. It doesn't have to stay in some sort of orphanage, but the birth mother still has the right to reconsider her decision, so to say. So in Austria, the situation is, I would not say ideal, but much, much better in Poland, which generates some, so to say, abortion travel, abortion tourism. And the demand for interpreting in abortion clinics is partly met by activist groups. This is, of course, true not only about Austria. The oldest of those groups is Ciocia Basia, which is active in Berlin. Another one exists in the Czech Republic, and Ciocia Wienia, which exists in Vienna, has been now active for over 3 years. And it was not so easy, as you can imagine, to get access to this group, because Sonia and I, we were aware of this particular setting, and we were interested in investigating it, but it was quite difficult to gain access. But we were very lucky, because at some point, Victoria joined us. And Victoria, at that time, was an MA student of Sonia. And Victoria wanted to write her MA thesis about the interpreting activities of Ciocia Wienia. And she was also associated with the group. She also worked for that group. So we saw that as an excellent opportunity to gather lots of interesting material. And this is what we did. And Victoria was able to complete her MA thesis on the basis of this material. But the three of us have also been able to write 3 papers. There are 3 papers by now. Now, what does Ciocia Wienia do? Here is the list of what they offer. So as you can see, it's not only about interpreting. Interpreting is just one aspect of their work, which is the one that attracted our attention for sure. But they do much more than just interpreting. And because of this, their role also as interpreters is very hybrid. They also perform the role of organizers very, very explicitly. And this is quite different from what public service interpreters, professional public service interpreters do usually. So our data collection method is maybe a bit old-fashioned. What we did was just interview members of the group, of the collective. We did that 2 years ago, and we had 13 quite long interviews, which generated almost 12 hours of material. And we were talking about many different topics, not only about ethics, which I'm discussing right now. Our interviewees are mostly female. Their age is between 20 plus and 60 plus. That's a much wider range than I expected, to be honest, because at the beginning I thought they would all be in their 20s, like Victoria, but there were quite a few in their 40s, and the oldest one was over 60. 4 of them have a background in translation and interpreting, which means they were studying it at the moment of conducting the interviews or at some time in the past, but none of them was a fully qualified interpreter at the time of doing the interviews. And later on, we did a follow-up. We did it this year because, as I've already mentioned, we learned about anonymous births in which they also help. So we learned it's not just abortion clinics, but there is another setting. And anonymous births happen in public hospitals. Certainly, they are much more complex. They require much more time and effort. So we conducted this focus group to gather some more information about anonymous births with a smaller group of activists, those ones who have lots of experience helping in anonymous births. So here are our research questions related to ethics. So first of all, what kinds of ethical dilemmas do they experience? What strategic translatorial decisions do they take and why? And is interpreting ethics a topic that they talk about? Do they have some joint translation interpreting policy, so to say? And finally, how does what they do correspond to the premises of feminist interpreting? And I'd like to just mention very briefly the theoretical background to the study. There is, of course, lots of literature about interpreter ethics, but about interpreter ethics in this specific context, activist interpreting, it is said that 2 ethical issues are particularly relevant: impartiality and expertise. And I'm talking now about impartiality. I will be talking about impartiality, first of all, leaving expertise a bit aside. And the same is true about feminist translation and interpreting ethics. I mean, this notion of impartiality as something that is not necessarily so desirable. That impartiality is seen as something that can be more of a hindrance than help. And activist interpreting and feminist interpreting both endorse interventionist strategies. So you can also, as an interpreter, intervene actively in the interaction, but you have to be open about your agenda. So you have to explain to the parties what you do. For example, if you translate a book with a feminist agenda, what you normally do is to explain your translation choices in a kind of postscriptum or whatever. Okay. So when we looked at our data already transcribed, we saw three salient topics related to interpreting ethics. First, examples of individual ethical reflection and decision-making. Second, this kind of transfer from the individual level to the collective level in ethical reflection. And finally, we see evidence of the emergent normative system that the collective seems to have developed. So I will now show you some extracts from the data to illustrate those three topics. So here we have an example about individual ethical reflection. And this is a story that begins by a day before surgical abortion. This patient was supposed to be given a pill that stops the development of pregnancy. And the scene is described here. The doctor says something that surprised and puzzled the interpreter. Here's a pill that you need to take, and as a result, the heart will stop beating. So this was something that she thought was strange to say, and she did not interpret that at the beginning. But the doctor kept repeating this, and finally she decided she would render that faithfully. The result of this, which is not described in this particular extract, was that the patient started crying, and she said she would not take the pill. And the interpreter then started negotiating with the doctor, saying, okay, so maybe we can take this pill and she will reconsider. She can maybe take this pill a bit later, which proved impossible because the pill was only supposed to be swallowed in the hospital. So the whole encounter took a very different course than expected. And if we look at this incident in the light of Cecilia Vadencio's model of renditions, the situation developed as follows. First, we have a substituted rendition, possibly quite vague. So the interpreter says something which is not an exact translation of the words, the heart will stop beating. Finally, when the doctor insists, the interpreter delivers a close rendition. And when the patient refuses to take the pill and starts crying, we have a series of non-renditions. So the interpreter starts negotiating directly with the doctor. So this is a rather complex story. And this is how this was summed up by this particular interviewee. The lesson that she has drawn from this is you don't translate what the doctor says. You don't have to. So it's not always appropriate to translate everything. And importantly, this is the story that was not only told, but by this one person to whom it happened, but it was also referred to by other interviewees who have heard about it. And it was a kind of formative experience, it seems, not only for this individual activist interpreter, but also more in a collective sense for the whole group. Here we have another example at the individual level. Here we have the question, why do you come so late? And the interpreter says, I did not translate this. I simply did not translate this. But I asked myself whether it is correct to withhold stuff. It was no easy decision not to translate that. So again, we can see evidence of this individual reflection. What should I do in this particular situation? And we have a zero rendition. So this question is deleted. As it was embedded in some more discourse, here the doctor did not protest, the doctor did not demand to have an answer to this particular question. So the next stage is from individual to collective ethical reflection. So we have much evidence that the activist interpreters actually talk about such situations and discuss what happened and what they did. And as you can see in the second example, they actually had a meeting in the clinic to admonish the staff of the clinic, which, as they said, did not work very well. So they decided to avoid this clinic in the future as much as possible. This transition from the individual to collective level happens in the so-called plenaries. These are meetings that they have every 2 weeks, and they discuss many different topics there. They take some decisions and so on. But interpreting and those strategies of what to do if you have that sort of an ethical dilemma, this is also quite a big topic. But also individually, they consult each other, particularly if there are newcomers joining the group and they go to interpret in the clinic for the first time or the second time. They are in touch. They use phones, they use communicators, and there is always someone who can be contacted and can provide some support, some advice. Right, so here again we have this question, why so late? But as you can see, no hesitation is reported by the interpreter. And the interpreter decides to interpret what the doctor says, and she also adds a footnote, so to say, from her own experience. So she tries to reassure the patient and say that some complications don't happen often, that she shouldn't be afraid. So what we have here is a substituted rendition, distancing through third person. As you can see, the interpreter is not saying I, the person said this and that. But I want to tell you that it happens very rarely. This is a non-rendition, giving advice directly to the client. And now we come to the third stage. So as a result of this individual reflection first, and then this group process of discussion, consideration, and so on and so forth, we have an emergent normative system. It is very visible here. So this particular interpreter has not experienced this sort of situation, but she already has some a priori criteria of what to do. if something like this happens to her, right? So this is, I think, very clear evidence that this normative system already exists. Another evidence is that they have sort of admission criteria. So it was also mentioned by 2 or 3 different interviewees, actually, that they had this particular candidate who wanted to interpret on behalf of the group. But this person was very much into this conduit model of interpreting, as we call it. So she thought you have to interpret everything very accurately. And the clash of opinions was so strong that they had some discussion, email discussions, and finally she did not start interpreting for the group because she was not able to accept this particular normative system. This normative system also extends to the language. They are very careful not to sustain the existing abortion stigma through the language. So, for example, they never say baby, but they are very careful to always say fetus or embryo, depending on the stage of pregnancy. And it's also very wrong for them to call about a pregnant woman as a mother or a future mother. This is for them just a pregnant person or a pregnant woman. So if someone uses that kind of language, they normally rephrase. So as for our study on the ethics of activist interpreting, these are the conclusions that I can offer. The dilemmas are situations that clash with the activist, feminist, and pro-choice perspective, and they definitely have much freedom to use strategies of substituted rendition, zero rendition, non-rendition, and sometimes it takes the form of direct confrontation or negotiation with clinic staff, which means sometimes it looks like they simply quarrel and try to persuade the clinic staff to behave in a different manner. The activists also usually rephrase what they see as judgmental language. And the Ciocia Wienia activist accompanying a person to an abortion clinic or to a hospital will always act both as a companion as an interpreter, protecting the client from possible interference and also protecting their mental well-being. Questions about interpreting ethics, as we have seen, seem important to the group, very important in fact. They are openly discussed during those bi-weekly plenaries, and they are also discussed between individual activists. But when we look at the premises of feminist interpreting, those interventionist practices can be viewed as on one hand, they can be viewed as a strategy of resistance to male-dominated praxis and structures, and also the linguistic manifestations of those structures, and of establishing more gender justice as a result. But on the other hand, those invisible substituted and zero renditions, without informing either patients or clinic staff about the interpreter's agenda and about the fact that the interpreter is not interpreting accurately, but deleting stuff or adding stuff, as a matter of fact, this can be viewed as somewhat problematic from the view of feminist interpreting ethics. Okay, so after offering those conclusions to one of the studies, I'm also going to advertise a bit to other papers which we have published. Actually, one is published and the other one, I just returned the PDF proofs today. So I think the one in translation and interpreting studies will be published in about a week or 2 weeks. And the other one has already been published, both in open access as well. And one is about the emotional challenges. So to say about the negative side of emotions, emotion management in this particular context. The other one is about the positive side. So what motivates them to work and continue working in spite of those challenges that exist. Okay, so I give you just a preview because I have no time to discuss both those studies in much detail. They are based on the very same material, but we look at different aspects because those interviews were long, as I said, and we discussed a range of topics. So which situations are described as emotionally challenging? What specific feelings are triggered by those challenges? How persistent are they? And which coping strategies have these activists developed? These are the questions for this study. So I'll just give you also some quotes, but in a minute. First, these are our research questions related to motivations. What motivates our interviewees to do this kind of work? This is a very important question, an interesting one, because they work for free, right? They devote their time and lots of effort. So we normally don't ask that about professional interpreters who work because they are paid for it. But if someone works for free, it's of course very fair to ask why. And then also, how is there a collective understanding of the motivations that they have and what keeps them engaged in the face of the challenges and stresses which we described in this previous study. So just to give you a few more quotes about this emotional dimension. So there's a feeling of sadness. Very often this sadness is triggered by the fact that about 70% of the cases they handle is related to fetal impairment. So in these cases, this pregnant person actually wanted to be pregnant, and some of them even tried to get pregnant for quite a long time, right? So this was a very much wanted pregnancy, after which in about 12th or 13th week, they get the results of medical tests and they learn that there is something very wrong with the pregnancy. And nothing can be done about this in Poland, sadly. So they have no choice in Poland but to continue with the pregnancy until the end, even if the baby dies after 1 day or it is born dead even, because, for example, it does not have a head even. Even in such cases, the women here would have to continue with the pregnancy. So here we have a very telling example. In this fragment, the patient was being sedated, and before that, the doctor says, imagine a nice place where you would like to be. So maybe you can feel like you are there. And she said she wanted to be on a beach. And then when she woke up, she said something like that. Very, very moving. And this is also something that had to be interpreted, of course. So this was something really moving for the interpreter, but at the same time, she said it was something beautiful, something that has stayed with her very much. Sadness is also caused by cases where they learn that the pregnancy is too advanced to terminate and they cannot help this particular woman. What they can do is maybe send her to another country where it is still possible to terminate until like maybe 20th week, or they can offer help in this anonymous birth, which I mentioned. Frustration and anger. There is much talk about frustration with the political situation in Poland. This is so barbaric, as this particular interview has told us. But at the same time, this feeling of frustration and being angry is a very important motivator for them. So this is among the most important motives that they mention for their engagement and for their work. They feel angry and they translate this anger in the desire to help, to do something very concrete, to help particular people who experience this kind of barbarism, this kind of injustice. In some cases, frustration can be caused by patients' anti-abortion beliefs. So some people who come, they say, okay, I'm an exception, so I need to have an abortion, but generally, I'm against abortion. So, for example, one of the activists mentioned a situation where she was in the waiting room of the abortion clinics with two patients. And one patient had a pregnancy with fetal impairment, the other had a healthy pregnancy. And the one with fetal impairment starts saying, oh, I would never terminate if this pregnancy was healthy. And, so to provoke a kind of discussion. And this activist interpreter is there in the middle. So yeah, there is also this kind of problem here, which is very, very specific for this particular setting, I would say. Stress can be also caused by deficits in expertise. And here we have an example relating to anonymous births, where they get a specific kind of anesthesia that is injected in the spine. And this interpreter says very honestly, I just wanted to cry when I saw what I have to translate. This was a kind of form, right? So she felt very helpless. And of course, expertise is another very important topic for volunteer, for activist interpreting, which we have left aside until now, but we are also preparing conference presentation about this and maybe also a paper. I still don't know. Right, so these are some previews of the other questions, those questions about emotions that we have also investigated, and we described them in the two other papers, in Translation in Society and Translation and Interpreting Studies. So, as I promised, I will end with that, and we still have about 15 minutes for questions and answers. Thank you very much.